And welcome into To Your Health. It's February. February means it's Heart Month, this little ticker that's been with you a long time. And guess what? It can age, it can get sick, and it can even be a source of bad health in your life. So, in order to keep it as healthy as we can, we brought in the expert, Jamie Myrick, and you are the manager of cardiology and cardiac intensive care for the Baptist Health System, but primarily you're at Baptist South.
Correct.
Because that's where the major cardiac is taken care of in the Baptist system, right?
Absolutely.
It's a good area.
It is a good area.
Yeah. You know, back in 2003, I had 6 bypasses on my heart. Oh, she looks surprised. And I'm still here. And I'm doing very well, actually, knock on wood. And basically the funny part about it, everybody kept saying, well, Jack, did you have a heart attack? No, my heart is perfectly healthy. It's just those funny little arteries got all clogged up with the bad stuff, I suspect. And that's the reason for the bypass. So what are some signs that, you know, the signs I had is I had chest pains.
Well, the signs can differ for men and women. Mm-hmm. Men generally complain of that elephant sitting on your chest, squeezing, shortness of breath. Even when you're resting, it's difficult to catch your breath. They may even be dizzy, could possibly faint, nausea, vomiting, sweating. Your classic chest pain, heart attack male patient that walks in is gray in color, they're sweating, they're complaining, they're holding their chest, I can't breathe, it hurts, it feels like something's sitting on my chest. That's your typical male patient. Your female patient is a little bit more subtle. And the problem is that women are more likely to die of heart attacks because the symptoms are more subtle. It's not that squeezing, chest pain, elephant sitting on your chest kind of symptoms. It's it could be pain or pressure in your back, gas pain or indigestion. There could be some pain in your jaw. With women, they get fatigued, and it could be fatigue that lasts for a few days, or it could be sudden, severe fatigue that's you just can't get over. So those signs and symptoms for women are much more subtle than the elephant sitting on your chest for men. Regardless of what signs or symptoms, if you think that you are having a cardiac event, we do urge you to immediately call 911 or get to your nearest emergency room so that you can be evaluated. Because the longer that you wait, if you are having a heart attack, the more damage that it's doing. If you cut off oxygen, like your arteries were clogged, if you cut off oxygen to that heart, that's muscle that's dying. Our goal is to have you treated and possibly having a stent placed in under 60 minutes from door to intervention.
Wow, that's fast.
Well, if you think about your muscle that's dying.
Because you don't have a lot of time to take care of it.
Right.
What about the aspirin? Now, we all hear about taking an aspirin.
Well, an aspirin is a medication that's used to help thin the blood out. So that's been the doctor's advice for years and years, is if you think you're having a heart attack, take an aspirin. And that is one of the first things that we do give you if you get to the hospital if you've not had one.
Okay.
You've got an event coming up next week. It's going to be on the 13th. It's a Saturday. It's at Baptist South, and it's to maintain a healthy heart.
Absolutely. It's called Love Your Heart Day, and it's something we're very proud of at Baptist, and it's grown phenomenally over the years. We actually had about 200 people last year that we saw as nurses and physicians at the hospital. You come, you call and register, and it's $20. You get an EKG, you get your blood pressure taken, you get your blood sugar checked, you get your cholesterol levels checked, and you'll actually have a cardiologist that looks at your EKG before you leave the hospital. So the good thing about that is that we have actually caught patients that were having significant changes and have had open heart surgery and saved their lives.
You know, that's probably the best $20 you could ever invest.
Absolutely.
Honestly.
Yes.
And especially with such a difference in your symptoms, and particularly with women where, you know, it's not maybe as severe or as obvious, so you would tend to let that go longer and then be in deeper trouble when it does hit.
Absolutely.
And what is the largest killer of women? Is it
heart disease? Heart disease is, because women are more likely to ignore those signs and symptoms. So when it does, when you are having a coronary event, you're more likely to die as a female.
When you talk about ignoring the signs, in other words, Good example. I started having my chest pains at Thanksgiving, and I had my heart surgery the 28th of December. So I had the signs, but I kind of said, well, I can kind of control this. But I told my family, we're going to get through Christmas, then I'm going to go see a cardiologist. My wife, who's a nurse, said, yeah, you could have made it a real nice Christmas with this going to your funeral for Christmas.
Right.
Absolutely.
But so if something persists more than, 3 or 4 days?
If you think that you're having a heart attack, you need to immediately seek help.
Right. But I mean, in the case of the women where it's more subtle.
In case of the women where it is more subtle, I would still, if you think that those symptoms, anything that's unusual, I would still follow up. Because like I said, the damage is done. We can't go back and undo dead heart muscle, but we can prevent further damage.
Good. Thank you so much. And just remember this, that heart, it's a muscle. It's going to grow old. Things can happen to it. If there's any sign that you may be having problems, call 911, get to an emergency room. It's the best advice we can give you. And we'll be right back right after this.